Hello, I am Mallory and I am from Westover, Vermont. When we can't read the report, it's like, what was the point of the report in the first place? Why did I, get this done? And when your doctor ignores it or doesn't even tell you that they've acknowledged it, it just feels like it was a waste of your time to go get that blood draw or spend 2 hours in the hospital waiting when you're just trying to help yourself. And it feels like it's just going into the abyss and nothing's happening with it.
Hi, I'm Rose. I'm from Middletown, Connecticut. I think I made that mistake once where I actually tried to understand a report. And it's so far over my head that I just ended up emailing or sending a message to the doctor saying, can you make heads or tails of this? Because I'm looking at it and I'm thinking, oh my God, this is horrible. Like I have all these things wrong with me. And then the doctor would look at me and goes, none of that's true. And I'm like, but am I not reading it right? It's just so of my understanding. So I tend to not look at reports anymore because it just makes me panic. I just think they need to be clearer and they need to be in everyday English.
Hi, folks. My name is John, and I'm greeting you from Atlanta, Georgia. So, yeah, kind of keeping an eye on what is in the records. It's almost like your credit report where you want to be sure that the information in there is accurate.
My name is Shamika Marty. I'm originally from the East Coast, from New Jersey, but I now reside in San Francisco area. Going to the doctors, they always go through, even if there's something that you're no longer taking and you tell them to take it off. Every single time I encounter where they go through it, I'm like, he doesn't take that anymore. Why is that coming up? Oh, I put to delete it, but it still comes up and you still have to go through it twice because maybe the people who go through it don't put the correct dosage, or they really don't delete it, or it's just a thing where every single drug that you've ever taken is just happens to be on there no matter what, and you have to say yes or no and go through everything.
So I have certain health conditions that I need to get tested every 6 months when I'm having an issue, but maybe 3 months when I'm not. And it's hard to see time over time what's happening. So I'm like, I feel I'm digging for information. Like, when did I have the last test? What were those results? And it's really hard for me to have to go back through. It could be months. It could be a year worth of data to try to just look at it over that time span to see did something make it change, right? Because it bumps, it goes high, low, and without being able to see it easily, it's hard to keep track of it. It would really be nice if we had something, a feature where you can just click like maybe a history button and it would show you maybe your last 3 to 5 test results. So you can then say, okay, this is what's going on, or you can bring it back to the doctor and say, I have no clue, but look at how these are jumping. Because it's not easy for the doctor to see either. It would be nice to have a historical view, especially when it's something critical that you should be able to see and not have to work really hard at it. As a caregiver for a family member who has a pretty bad diagnosis. And so I've been bringing him to his doctor's appointments and really helping to navigate some of his questions and issues. And so we were sitting at my house one day and we were looking at his my chart and he saw something on there. And he was like, well, where did this come from? And so I was looking and I'm like, I have no idea. And it was inaccurate. But it was kind of a major inaccuracy. It could have really bad effects on future treatment. So I told him he had to start calling the doctors that he's been seeing to ask who put that on there and how do we remove it. So he called a couple and he finally found the doctor who put that out there. And she said that she had seen it on some form. And so now it's like, okay, well, what form? Because it's not right. And we need to get it off of his record. I don't know that it's been taken off yet. We're still working through that, but it's quite concerning how mistakes can get easily added, but not easily removed. I think that we need to find a way to fix that issue.
I'm currently pursuing a career in the medical field, and I myself have trouble reading over reports and understanding medical jargon that are in reports. And it's led me to ask peers in my program or professors in my program for medical advice on what my reports say, because I don't feel as though there's an open or ease of communication with my medical team. I feel as though we are lacking in our ability to communicate potentially life-threatening information about our healthcare to patients in the healthcare field at the moment. And I think that opening up more communication that is also effective will greatly benefit all of us patients out here. So I think it's great that I have access to my records when they're on the portal, but I oftentimes get a quick digest from the radiologist, and it's a lot of medical jargon that even myself as a person pursuing a medical degree doesn't always understand. So I find the information that I do receive about my medical studies isn't quite clear and doesn't give me the information that I'm looking for after I have my test done. Pretty daunted by all the information that is out there, and not being able to easily look through it all and gather what I need feels discouraging and almost turns me away from even going towards looking for documents that I need to go see a specialist. It feels really exhausting to have to put all that work in.
I'm Ron. I'm from Denver, Colorado. Hope that there's a better patient to development of systems relationship. As to really have patients involved in the development. And obviously there's going to be patients that, just like, those of us that have been volunteered our time for Consumer Voices, there's going to be patients that are going to be willing to put their input into development of patient portals. And, it's not that hard to find. And even if you only have a handful of patients that are helping, it's better than no patients. So you're getting it from a patient perspective instead of from a clinician perspective.